All right, welcome. We're finishing up Unit 1 with Chapter 7 about immunity. Again, Chapter 5, 6, and 7 have a lot of relatable themes, so it's a little bit hard to keep them straight. Bulk of Unit 1 is dedicated to Chapter 1 content, Chapter 2 content, and then a sprinkle of every chapter we've talked about so far. So, what is our immune system? This is what we've mentioned already. This is our body's way of responding against microorganisms, just responding against pathogens. You can kind of subject it down into a couple of different categories, but basically, it's going to be things that are non-specific, meaning they don't really care what they're fighting. They're just going to fight anything that doesn't look like us. Those are phagocytes, the neutrophils, macrophages, inflammation, fever are all examples of non-specific. Specific defense is our third line of defense. This is uh, we're going to produce specific antibodies against foreign substances. So we're going to produce a memory of that foreign substance that's causing us a problem, and we're going to produce something to fight it as well, immediately and later if we ever see it again. That's what the third line of defense and what specific immune response is talking about. Components of the lymphoid system or of our immune system is really the our immune system and our lymphatic system are basically married at the hip here. So lymphoid structures is talking about our lymphatic system. So in all of our capillaries, typically there's a lymph vessel that will carry somewhere in the neighborhood of 10 to 15% of fluid kind of away from capillary, and we'll circulate it to some of these lymphoid structures like our lymph nodes or spleen, um, other lymphoid tissue. It will circulate through there so that because in lymph nodes and other lymphatic tissue, thymus, spleen, our lymphocytes and other immune cells hang out and kind of get trained and learn about what to fight, what not to fight. And then we dump that fluid once it's been cleaned through our lymphatic system back into circulation. But that immune system needs lymph nodes to kind of be a good place for our white blood cells, our immune cells to mature and um, get trained on what to attack and that sort of thing. So, what are the primary components responsible for a body's non-specific defense mechanisms, such as phagocytosis and inflammation? So, what's the primary components for the body's non-specific? Yeah, this one's. I just realized this question's very obvious. Sorry, guys, not perfect. Yeah, I didn't mean to put the such as part, but these are phagocytes, inflammatory mediators, fever. These are body's non-specific immune response. So, other components of our immune system, we have tissues that help with immune cell development. Um, again, like actually physically making the immune cells or helping them develop into mature immune cells. That would be our bone marrow, is where all immune cells originate from. Bone marrow also is really important in making all blood cells. So, our bone marrow is, you think bone marrow inside our long bones mostly, you think blood cells. Um, Thymus helps us mature T lymphocytes, and then also the chemical mediators we talked about before with inflammation, histamine, bradykinin, also interleukins. Interleukins are basically chemical messengers that help kick in the immune response. The Morgul of interleukins is another chemical messenger released by our cells when they're under stress to say, "Hey, immune system, come help us." That's interleukins. This is just a picture of the different lymphatic parts of our immune system, different lymphoid tissues. We have lymph nodes, more common places under the arm, axillary. There's some in our intestines, our groin, cervical lymph nodes around our neck, thymus, spleen, bone marrow, all included as uh, lymphoid organs or tissues and part of combined with our immune system. They have a codependent relationship, so to speak. So, other things to talk about our immune system. Antigens. What is an antigen? So, all an antigen is basically a protein marker. It's HLA proteins, is what they're called. HLA proteins. They basically label cells of an individual. So, if, for example, if you were to look at the HLA protein on my cells, they would say Daniel Mawson. Not really, but that's essentially what it's saying. It's identifying you as this is Daniel Mawson's cell. So antigens are just protein markers on the outside of cells that kind of tell them what that is. If something comes into our body that doesn't have this HLA protein marker that says your name on it, it'd be identified as non-self. And the job of the immune system is to recognize the non-self antigens and then develop a response against them, whether that's non-specific or developing a third line of defense specific response with antibodies and memory cells to fight the antigen again later. So, how does the immune system distinguish between self and non-self antigens? Were you listening? If you were, you should be able to easily answer. It is number one through HLA proteins and that self-identify our cells. So again, antigens, they're sometimes called immunogens, but I think you just be simpler live with antigens again. Think of protein markers on the outside of cells that tell us something. Identify the cell. Immunogens is just mostly referring to antigens that are not self. They're going to cause issues. They're usually proteins, they're polysaccharides, glycoproteins. So in the family of carbs, in the family of protein, but typically they're proteins, some other substance that's not needed inside the cell. Cells that are big players in the immune system. We got our macrophages. Also, you'd put in there our fill cells, neutrophils, first responders, part of the non-specific response. And then you have our lymphocyte twins here. T and B lymphocytes are the breadwinners of the specific immune system. And this is the conversation here. So the types of specific immunity we have is we have humoral immunity, where antibodies are produced to protect the body, and then cellular mediated immunity. Lymphocytes, specifically T lymphocytes, develop a system to attack non-self antigen cells to protect the body. So again, the immune system can be a little bit of a complicated beast. I advise trying to organize it with concept mapping or trying to work it out. So if I just kind of put a box here in the middle, well, I can't draw tonight, that says immunity, then I'm going to break it down. I can break that down into the non-specific. I'm going to shorthand this just for purposes, and specific immune system. Right? Okay. So non-specific, what's involved in that? You've got phagocytes, which are neutrophils, macrophages. You got inflammation, you got fever, non-specific ways we fight stuff. Then you have specific, which basically is humoral immunity, which is B cells create antibodies to target. So again, specific means it's going to target a specific antigen. Non-specific is saying they're going to target any antigen that's non-self, any non-self identifying antigen. These are designed for a specific antigen. Humorals B cells, they create antibodies. I know I'm kind of writing this sloppy. And then you have cell-mediated immunity, which is the T cells, and they assist these guys with attacking cells actively. And both of these guys are going to make a memory cell so that our immune system response will be faster later. So that's the whole immune system in a nutshell right here. Just broke it down. And that's how you got to think of some of this stuff because it gets so complicated, right? So find ways to draw this out like this. So I just drew this right from memory. That's because I've taught this stuff, right? But if you can get to a point where you can work on trying to draw something like this from memory and then go back and make sure that it's correct, that is telling you that you know it. So you need to have this kind of general, this image understanding of what the immune system is. That's kind of basically it. And we can talk about this in class as well more, but hopefully that kind of helps a little bit. Let me clear that. Okay, so moving forward. So, what are the antibodies? They are also known as, I should say, antibodies, also known as, or the AKA immunoglobulins. If you want to be scientific and fancy, right, you would call antibodies immunoglobulins. The only reason that's nice to know, or maybe need to, okay, I'll say, the only reason immunoglobulins is a need to know is mainly just because it talks about the way that the different types of antibodies we have, they all are like this label of IG something, and IG just stands for immunoglobulin. That's all IG is. So we have some subtypes of antibodies that have common practices. So IgG, double G, double O, found in blood. IgG, double O, blood. IgM, first in increase in immune response. So IgM, I don't have any fun way of memorizing this one, but this is the first response. So that would be need to know. Really, all of these are need to know for the most part, but I'm putting a star here. Need to know. IgA, um, I don't have a good way of memorizing this one, but think of secretion. So tears, saliva, colostrum, that's in breast milk, that sort of thing. IgE, um, IgE is involved in allergies. And you kind of, if you say IgE equals allergies, it kind of rhymes. Maybe it doesn't, but I think of IgE equals allergies. There's the E's. IgE equals allergies. Maybe that helps. But so the histamine involved in inflammation, allergic responses from the body, IgE is involved in that. And then IgD is just attached to B cells and activates B cells. It's an immunoglobulin that's job is to help B cells kind of kick off the response and get kind of the ball rolling, basically. So, which immunoglobulin is the first to increase in response to an infection? The first one to raise levels and get going when there's an infection. If you answered IgM, you're correct. So chemical mediators, we've already kind of been talking about this, but involved in inflammation and immune reactions. Histamine is always kind of involved. Cytokines, interleukins, bradykinin. These are kind of your big ones. So histamine is that systemic inflammation response to hyperemia and permeable membrane or permeable capillaries, excuse me. Um, bradykinin, bradykinin was related to pain receptor kickoff, and also the same properties as histamine. Cytokines, interleukins are very similar. They're more about cytokines play a role in inflammation, and interleukins are basically just a chemical SOS signal to get the immune system going. I think that's most of them. You're probably going to hear histamine the most. So I think histamine and bradykinins, at least if you're going to summarize the chemical mediators you want to know, but just think of them as chemical signals, chemical messengers from our cells being attacked or dying to get the immune system going and kind of get the stuff happening. Yeah, again, this is signaling would be the highlight here. So immune response, again, self antigen versus non-self. Self antigens are going to be ignored by the immune system. If it says not self, our specific response and our non-specific response are going to kick into gear. Typically, if it's a new non-self antigen, the non-specific immune response will attack first. It will start to destroy. It will phagocytize. And then the specific immune response will eventually kick in and try and help with the acute response, and then make antibodies and memory cells to also be able to fight it later. So, which of the following best describes the difference between humoral immunity and cell mediated immunity? Hopefully, you got this from this conversation. Maybe give you a second to answer. If you answer number two, you're correct. Humoral immunity produces antibodies, while cellular immunity attacks non-self cells directly. They both will make memory cells of this incident so that the immune response will be faster next time they see this non-self antigen, but they go about their specific immune response a little bit different. So diagnostic tests involved around our immune system. You do a titer. What a titer is, a lot of you probably had to have these drawn before nursing school, before you started clinicals. You'll have, or if not before nursing school, you'll definitely have to have blood titers probably drawn as part of your lab workup for clinical rotations. Titers basically measure levels of those serum immunoglobulins for a specific disease. So if I got the MMR shot, measles, mumps, rubella shot as a kid, when you do a titer, my blood levels of measles, mumps, rubella antibody immunoglobulin should be elevated to the point that I could fight the disease. If they're not, it would be a negative test, and I don't have the antibodies, which is not good. I'd have to have the vaccine again and kind of all that. There's also something called the indirect Coombs indirect Combs or Coombs test. This detects Rh blood incompatibility. This is part of working up for blood transfusions to make sure that there's no the Rh antigen. If you don't know that much about, you got to review A&P on that about blood transfusions. But just as a highlight, Coombs test blood as a refresher for A&P. Blood cells all have antigens on the outside, and this is how you determine blood types. So if it has an antigen that says A, it's blood type A. If it also has an antigen on there that says Rh, they're A positive, saying that they have the Rh. If they had a B antigen on the outside, they would be blood type B. If they had no Rh, they'd be B negative. And so Coombs test is looking for compatibility between the Rh antigens and making sure blood types are compatible. Review some blood type compatibility if you're curious about that. Some other points still diving into immunity. There's something that we want to distinguish, that there's a natural immunity and innate immunity, gene specific related to ethnicity. So natural immunity is typically talking about different species that are immune to certain things. Like you would think of natural immunity, like I think it's mongoose, or maybe it's Tasmanian devil. Something, one of those type of creatures are like immune to certain types of snake venom, and that's a species genetic trait that's passed down so that they can fight those kind of snakes and eat them for food and protect their children and that sort of stuff. Innate immunity is gene specific, and this is related to, uh, long lines of history of ethnicity and that sort of stuff based on DNA. Um, Primary response is usually that first exposure to an antigen, and it's going to take a week or two for the antibodies to really reach efficient levels. So antibody production is a slow process. And that's why the second response would be that we get exposed to the same exact pathogen, but now we have the memory cells and we already have the antibodies made to fight it. And so it'll be a more rapid response, much more efficient. In a couple of days, our immune system will respond. So there's some conversations too about how do we acquire this immunity. So like, how do I get immune to measles, mumps, and rubella? Well, I get the vaccine. So let's talk about how do I acquire certain immunities. They're basically broken up into kind of a natural and an artificial category. And then they're going to be passive or active. So active natural is I have a natural exposure to the antigen. So active natural immunity, this is, again, these are four ways that we acquire this immunity. How do I get the immunity against a certain pathogen? So natural active or active natural is I get a natural exposure to something in the world around me. And then I would go through my primary and secondary response. I develop antibodies, and then I'm now immune to whatever that disease was, and I can fight it off later. Active artificial means that someone gave me that antigen to stimulate my immune system to do its response. So this is immunizations, vaccines that are designed to stimulate your antibody production, that sort of stuff. They are designed to take the place of the natural active and just artificially we're going to make it and make your body do this response. So you don't have to go find, you don't have to go nuzzle up with someone with chickenpox to get the immunity. You can get a vaccine and have the artificial immunity. And then on the other end of the scope, there's passive. So passive natural is that a transfer of certain antibodies from mom to fetus. So IgG can be transferred across the placenta because it's small enough into the baby in utero, or also the baby's going to get it from mom's breast milk. And this kind of helps protect the infant in general the first few weeks and few months of life before they are old enough and their body's stable enough to receive vaccines. Then passive artificial is short-term protection. This would be we physically inject you with the antibodies. So if you thought about this, like think about this. So if poisonous snakes, we have antivenom for that. Well, what is that? It's not a vaccine that prevents you from ever, you know, getting sick from getting bit by a extremely poisonous snake. What antivenom is basically a synthetic made, artificial made um uh antibody against that venom from that snake. And the reason that is because again, that a long-term immune response for you to make the antibodies could take 1 to 2 weeks. If you're bit by an extremely poisonous snake, you don't have 1 or 2 weeks before the effects will take place. So we can give an anti-venom for that specific snake venom that is giving you short-term artificially made antibodies against that venom or whatever the infecting pathogen is, and therefore hopefully delaying the effects and getting rid of it. But your body's not going to make any memory of that because your body didn't earn it. That's what kind of passive means. Like the baby is not going to have memory of what mom was immune to. It's short term to protect them for their first few months of life. They have to make their own. To make antibodies, you have to be exposed to something, whether that's a vaccine or in the world around you by natural active processes. So passive artificial is like a snake venom example. It's a short term, help me before snake venom causes it. And this is the table 7.3 in your book. It gives, again, another example of all this sort of stuff. Again, you can review this to kind of give you a better idea. And so infectious diseases in our immune system, vaccine rates kind of keep those lower. Vaccines are kind of an important part of infection control. And a couple of things to talk about: emerging versus re-emerging. Emerging basically means there's newly identified types of diseases or infections in a population. Re-emerging says there was once under control, but incidences rises. For example, like we have a vaccine for polio. It had been mostly eradicated from North America, but people stopped kind of vaccinating their children. And I understand concerns of vaccine harm, which is a legitimate concern as well. But polio is a big concern too. So it's a balancing act. But incidents of polio spiked back up, and this would be re-emerging because it was under control and now it's spiked back up. Emerging would be just a newly identified disease, like COVID at first was emerging in a population. Immunosuppression, here we're towards the end, this is a reduction of immune system response to prevent infection. So something that's causing the immune system to not be as active or effective. And this goes into allergic reactions and hypersensitivity. So there's several types of hypersensitivity reactions. Think allergic reactions in general. There's 4 main types of hypersensitivity, and this is need to know information. This is worth knowing. Hypersensitive reactions. Type 1 hypersensitive is just general allergic reactions. So your skin rash, your hay fever, maybe a little bit of nausea. This is your general allergy. Type 2 cytotoxic hypersensitivity. This is like cell destruction or death. This is an antigen on the cell membrane. Think of blood transfusion incompatibility causing blood cells to destroy themselves, that sort of stuff. That's cytotoxic. Type 3 is considered autoimmune diseases. So the own immune system is causing its own tissue damage. So, like lupus, autoimmune diseases. The autoimmune disease basically says our own body has made antibodies to attack a certain type of cell. So, for example, if you could think of um, type 1 diabetes is an autoimmune disease in actuality. Type 1 diabetes is that our body has produced antibodies that target or destroy the cells in the pancreas that make insulin, therefore causing low levels of natural insulin being made, our body unable to regulate blood glucose effectively, high blood sugar, therefore diabetes mellitus. But that's a type 1 disease. Type 1 is autoimmune, and we can't really fix that. We can only treat symptoms and manage blood sugars. That would be a type 3 reaction. Type 4 is cell mediated or delayed hypersensitivity. This just means that the immune system is a delayed response for some reason to a certain allergen. Transplant or like a transplant organ rejection syndrome would fall under type 4, delayed hypersensitivity. Actually, contact dermatitis means you'd come in contact and then break out in a rash after initial contact. That's delayed hypersensitivity. Let me backtrack. Type 1, backtrack too far. Type 1, technically, where am I doing? I'm all over the place. Sorry, guys. um, where am I? Okay. Backtracking now. I was clicking the wrong button. So type 1 is technically also anaphylaxis, just general anaphylaxis, being exposed to an allergen, and then a whole systemic effect. That's what anaphylaxis is. Anything from throat swelling, extreme, large amounts of histamine and inflammation. That still falls under type 1, just hypersensitivity. So if I'm allergic to nuts, I get anaphylaxis, my throat closes up. That's a type 1 hypersensitivity. I hope that kind of makes sense. Autoimmune disorders, again, etiology for these somewhat unknown for most of them. We know causative risk factors, but we don't always know exactly. Antibodies are formed against our own antigens for certain tissues, like the type 1 diabetes example I gave. And then it could affect, again, generalized body system like lupus. Lupus is very generalized, or it could affect specific organs. These are, again, diseases like Hashimoto, thyroiditis, lupus, rheumatic fever, MS, or not MS, excuse me, myasthenia gravis. MS is multiple sclerosis, excuse me. Scleroderma, pernicious anemia. Um, so the autoimmune process, as a summary again, is that normal immune response is we get an antigen that's not self. We do our immune system, we make antibodies. Antibodies move to block that antigen and hopefully kill off whatever the pathogen is. Autoimmune disease says we have an antibody against our own our own antigens, attacks those antigens, causing destruction, general massive inflammation, and tissue damage. So, which of the following is an example of a type 1 hypersensitivity reaction? If you answer number one, you're correct. So, think of type 1 as any general allergy or systemic wide affecting allergy, like anaphylaxis shock to being allergic to peanuts. That's type 1. Type 2 is to like cell destruction. Typically, this is blood transfusion, hemolytic blood transfusion, cytotoxic reaction. 3, type 3 is more with those autoimmune diseases, rheumatoid arthritis, myasthenia gravis, lupus, and then contact dermatitis and delayed immune system response. Number 4 here is type 4. Which of the following statements best describes an autoimmune disorder? Just talked about it. What would you use? Pick one of these sentences to describe it. All right. Sorry. And if you pick number 1, you're correct. It's whatever reason not recognizing self antigens. Last couple slides here. Immunodeficiency. This word, immunodeficiency. Immunodeficiency means our immune system is deficient. There you go. There's the word, but it means that there's a partial or possible total loss of our immune system components. And this just, as soon as you hear immunodeficiency or suppressed immune system, you got to think number two here on the slide is that we're definitely, as soon as we hear about immunodeficiency, we're thinking increased risk of infection and cancer, but increased risk of infection and also increased risk of super infections from usually non-pathogenic normal flora. That's where you get the fungal infections and stuff like that. So loss of immune response, basic fundamental deficiencies. If there's issues with a lot of our large lymphatic organs like our spleen, or issues with our spleen, liver makes a lot of proteins and does a lot for maintaining our blood cell production. And then if I'm getting treated for cancer, that usually is always going to, so if I get treated for cancer, radiation, chemotherapy, these treatments are like, they're going to, basically these treatments are designed to kill cancer cells, to kill malignant cells, but in that process they're going to kill good healthy cells and therefore decrease immunodeficiency, the whole immune system. So your big thing to think about with immunodeficiency is huge more increased risk of infection, and any drugs that suppress it or radiation or chemotherapy is going to lead me to is going to cause immunodeficiency, basically. So think cancer, chemotherapy, immunosuppressant drugs, because I'm a transplant patient and I got a new, liver or whatever, cause immunodeficiency. So again, it's when you have immunodeficiency, like I mentioned, you're going to have a predisposed to be caused by normal flora, normal microorganism flora causing infections. And they're usually difficult to treat because your immune system is not working effectively. And so for some of these patients, depending on what's going on, if they're going to have a procedure that's invasive or requires some kind of surgical incision, they may treat them prophylactically with antibiotics and such like that. And to round out, why are individuals with immunodeficiency at higher risk for opportunistic infection? And this is pretty simple. Think of it this way. Number three, they have a reduced immune system response. So that wraps up all the Unit 1 chapters. I know it's a lot. Your big focus is get those terms down from Chapter 1, work on getting the immune system, or work on understanding all the components from Chapter 2, really fluid, electrolyte and acid base imbalances and what that looks like. And then with the other chapters, it's some of the stuff that's more relatable to nursing practice now. The immune chapter 5, 6, and 7 is just make a chart, find a way to keep inflammation and the immune system straight in your head, draw pictures, that sort of stuff. As always, come to me with any questions. Thank you guys for your time. I hope you guys have a good evening.